In this era of identity politics, it seems nearly everyone is in a minority. Nearly everyone belongs to a group that is either maligned or oppressed. Everyone except those deemed privileged not to be victimized, or worse, benefiting or even responsible for promoting such conditions. One of the groups that belongs to the default population that does not benefit from identity politics is the lonely male. Today I'll be speaking to Dr. Robert Hamm, a psychologist in West Hartford Center. I'm Pat Kazakoff. You're watching Psychological Insights. Stay with me, and we're going to talk about the challenges of being a man in today's world. Dr. Hamm.
Yes.
Welcome.
Thank you. Thank you, Pat.
So I understand that the American Psychological Association in August of 2018 set up guidelines of how to deal with the psychology of the male.
Mm-hmm. Okay. You could call
Why
that.
why so late?
That's a good question. It is late. It's not that these issues have suddenly emerged, but I think because men have been sort of neglected in a sense with all of the strident discussion in the media, and for good reason. Identity politics, the issues of various minorities, not that women are in a minority, but nonetheless have been an oppressed group for, culturally for centuries, has been given much more attention. The male has become neglected.
So is there some sort of movement, sociological movement that predicted this change? For example, the Me Too movement, or else in the 60s we had the advent of the birth control pill.
Right.
Did that have an effect on this neglect of the male?
In an indirect way, yeah, I think that these changes, these events, they're not really events, but phenomena.
Well, they're movements.
Yeah, phenomena in society, hashtag Me Too, for example, I think are manifestations, not causes, but they're, the signs that things have changed. And so events such as the invention of the birth control, those things I think have contributed to, but they also, events in our world such as hashtag Me Too are signs that these are manifestations of changes afoot in our society.
Well, something like the advent of the birth control pill in the 60s,
Right.
I mean, that had to be huge because it changed. The male was previously the aggressor, and now you have the male and female really on equal terms, on equal status.
It contributed to changes in the liberation of women. Although ironically, I think in the 60s, for those of us who may remember back then in 70s, I think for men, they benefited from that because changes in our roles in society and the economic privileges and sociological biases that favored men were still there.
So what would be the benefits in that era? How did men benefit? I thought that perhaps women benefited.
Well, it enabled women to make choices for themselves. But I think that it gave people license to express themselves without due consideration to the psychological and emotional ramifications of the choices
Or the
that
consequences, the
Exactly.
physical consequences.
Physical and emotional.
And what about the male, though? What were the benefits to the male of the birth control pill? What would you deem as the benefit?
Well, even if a woman is given greater sexual freedom, if she doesn't have that psychological freedom to feel it is an equal to a man, whether it's in the workplace or in a marriage or in a relationship of that sort, it isn't such a victory as it may seem. There still is that privileging of gender that men still benefit from, a sense of psychological freedom or dominance that allows them to make choices that women don't have because they don't have the same power in the workforce, or liberating themselves from the role of being a mother, as opposed to someone who has more fluidity of choices in life. Sexual freedom doesn't really pan out in giving you those choices so much unless you have a sense of freedom and autonomy in other ways.
So did men, would you say that their freedom and autonomy wasn't really affected by the birth control pill? Because they were just doing what they were always doing? Or was there some sort of psychological change because now women were liberated, in quotation marks?
Well, as I said, I think that it contributed, the sexual revolution of the 60s contributed to these changes that eventuated in where we are today, with a greater degree of freedom and equality for women. But that's a slow process. So initially, it gave women more choices, but I think the true freedom and autonomy that women have been establishing over time has been the culmination of other events in the world that we live in. So it's taken time.
And are you saying that those kinds of freedoms that women have are now inhibiting men on some level? The balance of power has shifted.
It's shifting. I'm not saying that women are equal in every way. It's still in process. But since the 60s, their times have changed, and it's almost comical if we look at a series on television such as Mad Men, look back, and we see what was considered to be normal and acceptable at one time. Now almost, it's embarrassing.
Right, it's embarrassing, it's humiliating. So what do the men present with when they come in to see you? I mean, certainly they don't say to you, I'm a victim of identity politics.
Not exactly.
So what do they say?
Well, different things. I mean, sometimes it might be a case where a young man is in a relationship and he doesn't want to do things that might be offensive or hurtful, and is unsure how to navigate that. But I think more often, young men in particular, I think the issues of older men are somewhat different. Young boys, adolescent boys that I work with, or young men, are more concerned about how should I be in a relationship?
How should I
be in a relationship, and what does it mean to be a man?
And so what does it mean to be a man now? Like, what I know what it used to mean. It used to mean strong, stoic, aggressive. That's what it used to mean. What does it mean now?
Oh, it depends on who you talk to, and whose narrative that you're following. And that's part of the problem that we are struggling with right now, is there is no single narrative that guides men, and so they're confused. So it is largely determined by which tribe you identify with, and whose blog you're following, and which channel on television that you're listening to.
So the main problem, what I'm hearing from you, is confusion.
Confusion, or what is even worse, a tribalism, where a divisiveness, I think, has eventuated in our society today, where people are very strident about their belief systems and are at odds. Now, we certainly see that in our political system today. Politics are more divisive than ever, and that includes sexual politics. There's a lot of feelings of animosity and confusion, and people are sort of digging in their heels about that what they feel they've given a lot of ground, and men in particular feel that they've lost a lot of, and they have, and are resentful, and many men feel emasculated. I mean, they want to be, I think, successful, and to have a successful way of dealing with other people, but their ideas about what necessitates that is different.
So when you say they're emasculated, where's that coming from? Is that coming from their mothers? Is it coming from their girlfriends? Is it coming from the workplace where there's more women working? Where's that emasculation coming from?
All those sources. Mainly it's in the changes that we live in today. So, such as #MeToo has brought to mind questions about what's appropriate. If a man is interested in a woman, how does he do that? And when they're dating and in a relationship, what's appropriate and what's not, what's sensitive, what's not. And if you question yourself enough, you end up feeling that you're just tied up in knots. And so men sometimes then interpret that as emasculation, that there's a part of them psychologically that identifies with this idea that to be a man is to be aggressive and to be confident. As part of it is driven by hormones, but a lot of it is determined by, who we believe we should be, how we're raised, and the messages we get in the world we live in.
So what I'm hearing is confusion.
Confusion or entrenchment. So it creates divisiveness where people feel that there are certain rights that they are not, that have been taken from them.
Do men express that when they see
yes,
you?
Yes, a lot of anger towards women. A lot of anger.
And what does that anger look like? Like, why towards women? Why aren't they angry towards themselves?
I think it's easier to blame other people.
I don't know if that's a psychological answer or it's just a human.
It's a human thing.
Right.
Yeah.
And so they're blaming women. And what are they blaming women for? Like, what are their words?
Well, it's not just women, but I think society and, so changes, people who entrench against changes become reactionary, blame the changes in society, the liberals, it can be globalized, the media, whoever it is that becomes your target, becomes a source of hostility and divisiveness. But a lot of it is directed towards, towards women or specific groups. Same with racism, in economics, those who have been privileged in the past, let's say the white American male, found a lot of their privileges and they target groups, and rather than looking at the problems in the system, there's a scapegoat.
And so women are the scapegoat?
Sometimes. Yeah, misogyny, resentment, that can, that entrenchment manifests in terms of sort of exaggeration of misogynistic beliefs that women are conniving or power-driven, and even if it isn't something that is stated overtly, I think it's embedded there.
And so that's causing enough problems for men to come and see you.
It contributes to it. Men that feel that they're depressed, they don't have the power, they don't have the freedoms that they used to, or they feel neglected.
Do they articulate that?
Many men don't. They're not aware of these concerns as the sources of it, but those that are more, educated, culturally sophisticated, are able to put their fingers on, what it is that's troubling them, as far as this issue of identity politics and masculinity are concerned.
And so
yes.
what are the solutions? Like, how do you work with them to get to the root of that? When you say they don't come in with that as a problem,
Mm-hmm.
they come in with other things as a
Usually,
problem.
sometimes they do. I try to try to help them to identify what are the issues that are concerning them, what are their thoughts and feelings about it, and I try to help them to, in parsing all that out, to have greater empathy for the targets of their hostility, women in particular, so that they can sort this out for themselves, and then they can identify what the solutions are. So through empathy and the golden rule, so to speak, they develop an understanding that that it isn't necessarily someone else's hostility towards them or insensitivity to them, but rather that women, just like men, want that sense of freedom and autonomy and respect, and by granting that, it's not a zero-sum game. It gives them a greater degree of freedom to negotiate their needs with others. Well, that's a long process in getting to that.
Are you seeing more men in your practice than you ever did before?
No, I see probably about 3/4 of my practice is working with men.
3/4 of your practice?
Yeah.
Well, then I would say that's a lot.
Yeah, it's not more so than it used to. I mean, that's pretty much the percentage I've seen. I think that many people who come in for psychotherapy are looking for a therapist that can identify with their concerns, and gender is one of those ways of making that decision. It doesn't necessarily mean that you're more sensitive to their concerns, but I think patients looking for a therapist are looking for someone that can identify, and so that's, I think.
So you're a male, they're a male. That makes perfect sense.
Uh-huh.
Now, but what about, do you cure this problem? Is there a cure for this? Like how does the person look after therapy? Like, what do they look like?
No, there isn't really a cure, so to speak. I mean, sometimes we have cures in therapy when we're really working with a very delimited problem, a symptom. But other than that, such as identity issues, male identity, there's no cure, except in the sense that what I want my male patients to eventuate at is a greater degree of reflectiveness and understanding and empathy towards women.
So that's what you're trying to train.
You're for
training
them to develop more compassion for themselves, so that they can be more open-minded and feel empowered to make choices in dialogue with others, with women about these issues when these questions come up, and to be more open. One of the problems that men have, that women have way over men, is that men don't express themselves. We all know this. It's kind of a joke,
Stoic.
Stoic. Keep things to themselves. Men are not as verbal, less inclined to seek psychotherapy, less inclined to admit their weaknesses and that they need help. So in psychotherapy, it's very helpful for them to have someone. The fact that they've sought a therapist, that's a big deal right there, to start with. But they need that channel, they need that forum. So having a therapist or talking with other men about these issues that they're concerned about, as long as it doesn't eventuate in a kind of tribalism where we are we're the oppressed group and you're the enemy, and that's one concern when you have groups of people who it becomes too insular. But if it doesn't eventuate in that, it's a very therapeutic, it's like a support system.
But how do you train a person to be more reflective? Like, how do you institute reflectiveness, or how do you institute empathy?
Talking.
Just talking.
Talking, yes. Talking about the issues. It opens things up, gets you thinking, And what I direct the thinking towards eventually is empathizing with someone else and then looking at yourself and what is your contribution to these issues? What are your responsibilities to find solutions?
It sounds like a very long process to me. Am I incorrect in that assumption?
It's a lifelong process. It's how we live, you know. I mean, psychotherapy can go on for years, but it doesn't have to remain in the therapist's office. This is where, you know, I help grease the wheels for a patient for the purpose of helping them to feel empowered and to give themselves permission to question these things rather than to harden themselves into some kind of ideology that's rigid and intolerant.
Yeah, no, I'm listening to you, and I'm just, obviously, I think of people that I know, and I'm wondering, how could they ever be empathetic? You know, they might be able to say the right words. They might be able to say, I'm really sorry for your loss. They might be able to say, I'm sorry that you're ill. But how can they feel it? How do they get to feel that?
Empathy.
Empathy.
And that's not easy to achieve. That's very hard if you don't have it. And again, how do you get there? By opening yourself up, talking, airing out your grievances, and having a therapist, for example, who can empathize with the person suffering about that. And that opening allows that person to eventuate at looking at themselves. That's not easy to do.
But how much, if you're born in a certain way, you're not an empathetic person, you're not a reflective person, which you say is part of society's norm for men. It's not so uncommon. How much empathy and reflection can you really, really get to?
You said born with?
Born, like you're born with not a lot of reflective power or empathetic power. That's just your makeup. You're hardwired.
Yeah, we're talking about the sociopath here, aren't we?
I didn't think so.
Well,
but how much can you develop that? Like what percentage?
Well, I believe that most people have that capacity. The main problem is getting people into the psychotherapist's office, I think. If you're not thinking about, if you're not open to, if you're not dialoguing, if you're only talking to your tribe and reading tropes that only reinforce your very limited belief systems, no, you're not going to get anywhere. That's the antithesis of growth, isn't it, and evolution. So I can't force people into my office to talk about these things, but I think everybody has the potential. Yes, I don't think people are born without that potential. The capacity of empathy is something that's hardwired neurologically into every human being, with very few exceptions.
We can save this for another time, but I'm wondering how this male issue affects the female issue. I mean, if men are feeling emasculated, if men are feeling powerless, women must feel, as a group, they must feel something too.
Oh, yeah. Well, I would imagine that women, they feel the animosity. They're aware of the reaction, against all of these hard-won achievements. And so when they see the hostility that men feel, it only creates more divisiveness. And that's the purpose of having forums and discussions for open dialogue. So, you asked me about what brings a patient in. Do they want to talk about these things in particular? And I say, well, in some instances, not usually, but it does eventuate in our discussions for some men. But the concerns are different according to your level of maturity in life. And for a younger man, often it entails a confusion about what is my role, what's the proper role, what does it mean to be a man. An older man is often more concerned about the losses. He's lived in a different generation. He's seen the changes, and feels that sense of loss and resentment about all, that a world that he once lived in that he doesn't recognize anymore. And so there's a lot of resentment that older men have towards women, that they feel they've been left out, and they've been sort of neglected.
I've been talking to Dr. Robert Hamm, and I guess we come to the conclusion that empathy and reflection has to happen in order for men to not feel stigmatized and not to feel emasculated. I guess that's what the conclusion we come to.
Yeah, I would say talking about it, whether it's in a forum, a discussion group, or in the psychotherapist's office, that's where things get started, and the possibility to heal, to change, and to heal takes place. Yeah.
Thank you very much, Dr. Hamm. It's a pleasure, and perhaps one of your topics will be how this is affecting the female psyche.
Oh, okay. Gotcha. Hear you.
I've been talking to Dr. Robert Hamm. He is a psychology in West Hartford Center, and looking forward to seeing you next month. Thank you.